We talked about the structure of NIH. It's a federation of 27 different institutes, semi-autonomous for the most part. There are deeply embedded orthodoxies. It's bureaucratic. So reform is not easy. From your vantage point, what are some of the limiting factors that is, again, impeding your progress that, if you could change, would really accelerate a lot of what you're trying to drive?
The real question is, given the organization that exists, does it facilitate collaboration across scientific areas that lead to fruitful discoveries and fruitful advances? So this is something I've been working at really hard to encourage collaboration across institutes. This is a perennial thing that the Office of Director normally would do, or the Director of the NIH would do. What I've seen, I've been really, really pleasantly surprised by, is that these cross NIH initiatives just pop up out of the initiatives, out of the institutes themselves, right? So we have something called the Whole Person Initiative that I learned about from several institute directors. One of them leads the National Eye Institute, right? So, and he and some folks, other folks from other different institutes, including the National Institute of Complementary Medicine and Integrative Health, they led this whole of NIH approach to this whole person health, where fundamentally the point is that we should not be thinking about each disease system at a time alone in isolation. You have to think about these in the context of all of the human being, right? You heard this in the context of the NIAID, right? So you don't just, of course, you still have to analyze the pathogen and the bug, but that has to be done in the context of who is it infecting, what are the immune responses to that person, that bug. That person-centered approach is fundamental. It automatically ties together, no matter what the organization of the NIH, it ties together scientifically in this intellectual endeavor of how to make people healthier. And it's been really, really heartening to see the NIH close and personal, to see that kind of scientific collaboration happen. There are still institutional barriers to this. I'm still trying to learn about them and break them down. But I think the spirit is there to make that happen.